welcome. I'm Dr. Emily Sinai, Assistant Professor of Environmental Medicine and Public Health here at Mount Sinai. It is my pleasure to welcome you today to today's lunchtime chat in the Mount Sinai Institute for Exposomic Research, Environment and Health series. Each week features scientists studying the health impacts of complex environmental exposures. If you missed any of the previous sessions, don't worry about it. You can find all the videos available on our website. Now, the terrible impact of the pandemic over the last year has been undeniable. But through the pandemic, what is clear is that there is a new public awareness and consciousness about the critical role of public health and science. Today, you are going to hear from Dr. Allan and Dr. Perry Sheffield, who will share their unique perspectives to address the looming health crisis that we all know is in front of us. And that, of course, is the climate crisis. I'll start with Dr. Just. Dr. Just is an epidemiologist and an assistant professor for environmental medicine and public health at Mount Sinai. Dr. Just has developed novel methods using NASA satellite air pollution and temperature data to really drill down and reconstruct past environmental exposures to help us understand how they affect health outcomes. Dr. Perry Sheffield is Associate Professor for Environmental Medicine and Public Health, as well as Pediatrics. Dr. Sheffield is a clinician scientist and a national advocate committed to protecting children's health. She co-leads the New York State Children's Environmental Health Center Network, which provides clinical services to families and trains physicians throughout the state to incorporate environmental health considerations into their practice. Dr. Sheffield's research focuses on climate change and human health, with emphasis on those most vulnerable. Now, today's presentation is going to be about 25 minutes, followed by 20 minutes for Q&A. I encourage everyone to submit your questions using the Q&A function. And if we can't get to everyone's questions, we're going to try to work all the answers into an email, as well as share that on social media using the hashtag environmental chats. That's hashtag environmental chats. And with that, I'll ask Drs. Just and Sheffield to go ahead and begin their presentation.
Thank you so much, and it's great to be here. So today we're going to be talking about this next societal public health challenge and tying this into our research and how there can be more opportunities for action from clinicians and communities to address some of these challenges with what we've learned. And we're speaking here from the Institute for Exposomic Research, where we're studying the totality of exposures across the human lifespan. And thinking about that broadly, where we're trying to better understand environmental exposures and how those relate to health so that we can translate that into innovative strategies to improve prevention and treatment. And today we're going to be speaking mostly about air pollution and heat in the context of climate change. During the introduction, it was mentioned that we're using satellite data. So what is a medical school doing working with satellite data? What does NASA have to do with this? Well, we're reconstructing exposures where you live, play, and work. We're using satellites that are orbiting the globe, and they're allowing us to go back in time and reconstruct exposures, even if you don't have an air quality monitoring station right outside your apartment building. We know that when we check our phone for what the weather might be, everyone in the city is being told the same temperature. Probably it's coming from LaGuardia Airport if you're in New York City, but we're not all experiencing the same temperatures. So we're using satellite-based modeling with a lot of machine learning, geostatistical, big data techniques to reconstruct, and we're going to share with you some of the maps of what we're able to pull together of what exposures people have had in the past. And the reason we do this is because improving our creating more accurate assessments of what people have been exposed to allows us to improve our environmental epidemiology, the health studies, where we understand the links between those exposures and their health. And this is why we're spending so much of our efforts in understanding the distribution of exposures in space and time. We often talk about environmental health in terms of contaminants in our water or in our food supply, but these are some examples that relate to where we are in space, the air that we're breathing, and the weather, the conditions around us.
We already understand from a large body of evidence that there are significant health effects associated with being exposed to air pollution in general and lots of specific air pollutants as we get more sophisticated with our understanding. We used to think that it just really affected breathing, but now we understand that it affects your brain, your heart, your blood vessels, your metabolism, overall life expectancy. It causes inflammation and it can affect heart rate and rhythm, your heart rhythm. We know that the American Heart Association has now considers air pollution a modifiable risk factor, which means there's something we can do about it. And it's important that we do that. And that the International Cancer Group called IARC has classified air pollution as a carcinogen. So all this evidence points to the importance of action. But it's not just air pollution, and it's not just air pollution acting the same way on all populations. We know that pregnant women, young children, and older people are most dramatically affected by these exposures because of what we call windows of vulnerability, or where they are in their life stage. And that's really important to think about too. Thinking more broadly than air pollution, we think about climate change writ large. You'll see on this diagram that air pollution is represented there up on the upper right, but that there's a whole host of other potential exposures related to climate change. It's the metaphoric and in some case the literal storm on the horizon. We know that climate change makes air pollution worse, but it also complicates many other health risks. And today we're going to focus a bit on the extreme heat portion of this pie, if you will, and talk about some of those health risks associated with heat and action people are taking to address that. So you don't hear this very often, but one of the good news parts of the pandemic, in our opinion, is that it has paved the way for new approaches. This year has taught us a lot, but one thing is that there is increasing public awareness of how place affects health now. And probably because of maps like this one that shows how COVID mortality rate differs by neighborhood across New York City, there's now this public awareness and this idea germinating more broadly. It's been pretty popular among environmental health scientists for a long time, but now more broadly, this idea of targeting interventions to specific areas.
And just as the public health impacts of the pandemic have varied substantially depending on where you live, so do these environmental exposures. And one that's quite dramatic is exposure to extreme heat because of a phenomenon known as the urban heat island effect, where the dark construction materials, the pavement and asphalt of urban areas and the lower density of trees and vegetation means that heat is really trapped and captured and retained, particularly through the nighttime hours in denser urban areas. We see that there's substantial variation in what temperature it is during a heat wave, for example. So this is some work led by postdoctoral fellow Dr. Daniel Carrion, where we've reconstructed temperature on a 1 kilometer grid. That's these smaller pixels that you see on the right, and then on the left is zoomed out that we're modeling the whole Northeast. Every hour going back years, so billions of predictions, where we've taken this data from the NASA satellites, including thermal remote sensing, and data from thousands of weather stations across this region, and we're able to reconstruct how temperature varies across the city. Previously, health studies have used a coarser resolution model, and you see on the right, this coarser grid is overlaid, where you would assume that everyone in one of these bigger rectangles that's 12 kilometers across has the same temperature exposure at a given hour. but we're able to reconstruct much finer variation, which means that the exposures that people have, if they stand outside their building, depends where they live in the city. And this isn't just in the city. We're able to do this across the region and also now nationally, and we have some studies doing this kind of work internationally. So using this kind of satellite information, big data modeling, allowing us to reconstruct exposures so that we can relate them to human health. We're even diving down even further. So this is the land surface temperature. The previous slide was showing you the air temperature that we experience when we're walking around. But the land surface temperature is what's directly retrieved by these satellites. And this is a new product that's even higher resolution, overlaid on a map. Some of you may recognize this is the Upper East Side, and Mount Sinai is in the middle of this. The Mount Sinai campus is in the middle of this slide, where we see that Central Park is cooler, where we have some trees, some natural vegetation. And if you walk just a few minutes, just walk 2 avenues, 5 minutes to the east, you can see much, much warmer surfaces. And really to be pointed out is this asphalt covered bus depot. And this asphalt covered bus depot gets much, much hotter here during this heat wave. So this whole thing is very zoomed in. And then when we zoom back out in the lower right, you see that this is the map and you can see the outline of Manhattan, clearly seeing that Central Park, and in particular the reservoir, the water in the middle of Central Park, are much cooler. We're able to reconstruct this really fine scale temperature variation and link that back to health, thinking about where you live as a determinant, that there's enormous inequities and variation that has to do with these land use decisions that's built in through residential segregation and structural racism, that there's enormous variation in temperature from neighborhood to neighborhood. And in the context of relating this back to the pandemic, there are also, with all of these public health challenges, there are secondary effects. So during a pandemic, when everyone had to stay home, there were missed doctor's appointments. That means that preventive care wasn't necessarily kept up. There were children that were missing their scheduled regular childhood vaccinations. It was more difficult to use community cooling centers as a shared space for people to avoid the health impacts of extreme heat, or to seek shelter from high winds during tropical storms and hurricanes. All of this happening in a time where there's increased attention to the toxic stress associated with police violence. So, this kind of secondary effects or these collateral effects, this is pervasive also in climate change. And that's why there was this diagram of the interrelation of some of these compounding effects, but it's not all about ill health.
That's right. It's not all collateral damage per se. And it's not all doomsday scenarios. In some cases, the solutions also have sort of co-benefits or collateral benefits, if you will. We live in a city and a state that is leading in terms of climate change action. Specifically, the New York City government is taking action on climate, and they understand that climate acts as Allan was just laying out, as a threat multiplier. Climate change acts in that way. And this city has one of the most advanced climate and health programs in the world. We have an epidemiology team at the City Department of Health that has developed New York City Heat Vulnerability Index to try to understand which populations living where are most at risk during something like a heat wave event. We also have teams led by people like Kizzy Charles Guzman, Munera Ahmed, Nancy Jeffrey, Hannah Siegel, all pictured here, that are helping to implement and also evaluate programs like the Cool Roofs Initiative, which was in some cases painting darker colored roofs a lighter color like white. Because as you saw in that image that Allan shared, we know that asphalt black surfaces on roofs are sinks for heat and can re-radiate that and increase the ambient or outdoor temperatures of heat. So a Cool Roofs program, they've also helped perpetuate a air conditioning prescription program and funding to give away air conditioning to at-risk individuals. They also have an interesting program called Be a Buddy, which works with senior centers and other community centers to pair neighbors or trusted individuals that live locally with homebound or high-risk individuals. And this was actually implemented initially as a emergency heat response program, but it has a lot of uses beyond heat. It can be used during other weather events or even non-weather disasters, like in the current pandemic. This program strengthens social networks. And we know that there's growing data that social networks are a critical health determinant. I mean, let's be real. The reality is that sometimes we all need a cool pool among friends to relax in. And one of the silver linings of COVID is seeing that society can adapt to great challenges. So Allan and I have laid out how this time brings new public awareness to the opportunities that environmental health data offers. And it's getting us closer to being able to measure and act on these exposures. As he said, or like we say in children's environmental health, where you live, learn, eat, sleep, play, pray, all of that. All of those places matter. So we've talked about the importance of precise exposure estimates. And here's an example of how focusing on specific populations can be important too. We found that the risks of heat-related emergency departments for young children in New York City differs by age. So during hot weather events, we saw that 1-year-old through 3-year-old children had a higher risk of going to the emergency room compared to infants, so children under 1, or even 4-year-olds. And this was an interesting finding because even within that very narrow age range, just 5 years effectively, we saw that there was a variation in risk. And so that raises questions about why, and is it behaviors, and are there tailored protective measures that we can take? We also know that ultimately to translate this data, clinicians need data access. We have a vision in which getting environmental exposure information is as easy as finding the nearest takeout. And to really change environmental exposures using the healthcare system, we're going to need access to that data, and we're going to need really specific information about what data matters for which population. Another example of a clinically actionable finding from our team is that we found that during hotter weather, children of all ages, so this time we were looking up through 18, children of all ages came to the emergency room more commonly. But when we looked at the more severe outcome of actually getting admitted to the hospital, we found that only adolescents actually had a higher hospitalization rate. So we're able to couple that finding within the New York City context with sort of the national understanding that 10,000 high school athletes get seen every year in the United States for treatment of heat illness. And so we're sort of crosswalking some national surveillance data with what we're finding locally to be able to potentially inform and drive our clinical recommendations. And as I said, ultimately, it's really about the translation. And our team's goal is to take research findings and then bring that into clinical practice. And people on our team like Erin Thanek, Lauren Zajac, who you might have heard from last presentation, Jennifer Acevedo, are leading these environmental health, an environmental health screening initiative in pediatric clinics and hospitals. We, as part of that, have developed clinical tools called prescriptions for prevention that enable, it's an actionable tool for clinicians to use, summarizing the research findings, but then actually taking it to an action step. So for example, what you see on the right there is our prescription for prevention around mold. We know it's a climate sensitive exposure. We know that during high rainfall events, that can lead to leaks or just high humidity conditions that translate into a greater risk of indoor mold. And clinicians can use this tool to really get at the heart of the message, this prescription for prevention, and then talk to families about the risks of mold, especially high-risk groups like people with asthma or allergies. And then also, we like to avoid unintended consequences. So thinking about safer ways to manage mold and not inadvertently leading to things like high concentration bleach exposures that could actually make some of those respiratory effects worse. And then we also have some practical tips for families, individuals, sports teams, for example, to think about while we're working to change those societal level or built environment reasons that are affecting exposures. And some of those individual level actions include things like making sure that sports teams have heat policies. When is it too hot to exercise? Are there modifications in place, like time of day that practices are taking place, or competitive events that could be put in place? Making sure that it's important not to wait until you're thirsty to drink, knowing that heat is a dangerous thing. And then crosswalking it with another topic of environmental health interest around turf fields or natural grass fields. We know that turf fields can actually get much hotter than grass. And so being cognizant of that and taking appropriate actions of whether or not that's actually closing fields during extreme weather events or making sure that they are watered down and cooled. And there's advice on all of this that different professional associations have put together.
On the topic of air quality and giving people actionable information, one option is the airnow.gov website and smartphone app, which can give you information about the air quality index where you are. And this can help people make decisions to modify their outdoor activities, adjust, when they're gonna have their windows open, or think about avoiding excess exposure to the worst air quality days. So this is a tool that's available now, and our hope is that the measurement of air quality will continue to improve over time, right? And bringing in new kinds of information so that we'll be able to help people better understand what their exposures are and then modify those. And so to return to this wheel of some of the health impacts related to climate change, it's a big list, but we're buoyed by the fact that researchers in the public health community broadly and here at Mount Sinai are making these links and translating research into these prescriptions for prevention and other tools that can help to modify and improve public health. And so this is also going to be critical. Improving our measurement of what people are exposed to is also really important to addressing long-standing inequities. And this is part of a long-term plan for both individuals and societies to come together and make spaces that are healthy and that promote better health across the life course. And this is also related to really the roots of all of this research that we've been undertaking. So with that, we want to move towards our Q&A. We're excited to take your questions about this big topic. But we wanted to first acknowledge the Institute for Exposomic Research, which we both belong, and previous presentations have talked a lot about this, the Region 2 PESU at Mount Sinai, the Night Check program, and acknowledging also funding from the National Institutes of Health and the National Institutes of Environmental Health Sciences.
Thank you, Allan. Thank you, Perry. A very great presentation, a lot of information there. We're going to dig into some questions in a minute, but first, a commercial message. I would like to invite you all to join us next Wednesday, that's May 12th, same time, for a conversation with Manish Arora moderated by Allan. Dr. Aurora will be discussing lifelong environmental exposures and risks for disease, such as autism and ALS, which means Lou Gehrig's disease. Now, if you don't mind advancing the slide, we're going to talk about some ways that you might be able to get involved if this has interested you. First off, if you have concerns within your own community, even in your own home, our team of scientists and physicians are here to help you. We regularly respond to individual questions and are also available to speak to community groups. So please do not hesitate to contact us. That's what we're all about, is getting this information out to the community. Also, if you want to become a little more involved, we're currently seeking nominations for the Mount Sinai Exposomics, or Exposomics, depending on how you say it, and Children's Environmental Health Board. This new board will drive philanthropically the work of the Institute for Exposomic Research. We are looking for people who are motivated to enact change and help us advance a strategic plan. Again, if you know anybody or you yourself are interested in perhaps joining this board, please get in touch with us. And if you have any ideas coming up for that you would like us to see us address, please don't hesitate to get in touch with us. So if you don't mind, Dr. Just, if you could stop sharing your slide. Okay, you talked about urban heat island effects. Are we all in an urban heat island if we're living in the city or living in a dense area? How do you know if you're in an urban heat island, and what are you supposed to do about it?
Yeah, so we do know that the major urban centers in the US are warmer than areas outside of them. And as we spoke about, it's related to the materials, the built environment of those cities. This is the largest impacts are at nighttime temperatures. It means that it doesn't cool down as much. And you need that rest. You need that opportunity to cool down at night during a big heat wave. Your cardiovascular system needs that break, particularly if you get a lot of exposure to heat during the daytime. So it's important for people to think about strategies, ventilation strategies or air conditioning strategies during those nighttime hours, because particularly when you're in a city, that's sort of when the impacts of that enhanced urban heat island are the worst. But we also know that it's different within the city, within any city, depending on where you live. But only now are we developing the tools to be able to map that out and better understand its role. In the long run, we'd like cities to use different materials. So Perry talked about a cool roofs program where we say, let's avoid having everything be, black asphalt. Let's think about more reflective surfaces. Let's increase the amount of vegetation and shade. Those are important strategies, part of a long-term adaptation. But in the short run, people also need to find opportunities to cool themselves to protect their health, particularly in the nighttime.
Dr. Sheffield, you want to respond to that? And you mentioned the painting the roofs white. Is that something that is actively being considered or being rolled out, or what's the status of that?
Yeah, the Cool Roofs program is something that has actually been going on in New York City for a long time, but it's happening internationally as well. I had the pleasure of being involved in a study actually in Western India, where they found in a hospital that didn't have central air conditioning, that a top floor had its own sort of urban heat island, which is, as Allan was saying, a difference in temperature. And sometimes that can be by about 15 degrees. And so that finding actually led them to change a dark colored roof surface to a China mosaic roof. And there's some really beautiful research coming out of the engineering field around how that can reduce indoor building temperatures, and then also ambient temperatures around those buildings as well.
So if we live in a New York City building, is there anyone we can contact if we wanted to advocate for something in our own buildings to push to get a white roof? Are you familiar with that?
I don't know at this stage the status of that, and but I know that there's some people who are taking it on privately, and I've also understood that there are a lot of things in the pipeline right now with the changing federal administration's incentives, and then at the state level, the organization called NYSERDA, the Energy Research Development Authority. They are coming out with more incentives now to make it more accessible for building owners to make modifications that are energy efficient and transitioning to cleaner fuels.
Perfect. Yeah, we just had someone in the chat who actually in their own building noticed several buildings around them who just recently installed some black roofing material. This was just, I guess, in the last couple of weeks. So this is something maybe we can advocate for ourselves and call and get in there and see what the deal is and how we get that going in our own communities. You mentioned mold, and this is a big topic and a complex topic. You talked about how to get rid of it. Is there any advice for people who feel they might have been exposed to mold? How toxic is it? What can we do for those who might be sensitive to it? Any thoughts?
Yeah, and the most important thing to remember when talking about mold is figuring out how to reduce the exposure for ongoing mold. And we know that mold is ubiquitous in the environment, but it varies a lot in terms of sort of the concentration of spores, if you will. And so while we expect to be exposed to some molds at any point that we walk outside, and in particular, we know that our indoor environments can, when they have the right conditions, can have higher levels. And while there's a lot out there in the media generally about different types of mold, some being more dangerous than others, in general, if you see it, if you smell it, or if you just have the conditions in your living space or workspace that are high humidity, then it's a setup for mold. And so as mold spores are always sort of floating around and traveling on us, if there's a receptive place for them, they will start to grow. And so the really critical thing is addressing this source of extra moisture, whether or not that's improved ventilation or fixing of leaks. That's really the heart of the matter.
Is there anything you can say about it clinically in terms of treating it? People who are sensitive to mold, is there any advice you'd give people who really have a medical issue related to it?
I think it's important to work with your medical provider to make sure. Often the symptoms are an indication that maybe the exposure has not been well treated, and so making sure that you're coming back to that. There's not. I think there are some misconceptions about whether or not there's an additional treatment that needs to happen. But from our standpoint, the treatment, the definitive treatment, is really reducing or eliminating the source of exposure.
Okay, terrific. Dr. Just, you talked about heat and you talked about air pollution, and you said something that I thought was really interesting, that we have very coarse measurements for it in any specific area, and that's what's driving the satellites. Can you explain a little bit more? Like if I listen to the weatherman and he tells me it's a certain temperature outside, that might not necessarily be the case for where I am. Is that what you're saying? And can you explain why that is?
Sure. So I think this is true of both air pollution and different weather phenomena, and we're talking a lot about heat. So the temperature varies where you are because there's variation at different scales. And within a city, it might depend whether you're, in a street that blocks the wind. And so, you would feel more temperature, you would feel higher temperatures because the air would be trapped, right? Or it might matter if you go down to the beach and you're able to be somewhere where you're cooled by the breeze and you're near water, which is much cooler. Or you're able to take a walk through the park and there's vegetation, and the moisture from the vegetation evaporating can cool things as well. And maybe there's a lot of shade that's sort of protecting you from the additional solar energy. So that kind of variation depends, can vary enormously just through a small walk through your neighborhood or going from neighborhood to neighborhood. But when we compare neighborhoods in aggregate, using those maps and models that I showed you, we see persistent, consistent average differences that have to do with, where there are more parks and more trees versus more asphalt, across our cities, our suburban spaces, and our rural areas. So there's some, there are places you can go near where you live that might be a little bit cooler, but also some neighborhoods just don't get the break that others do because of our physical geography.
So the other thing that I think is interesting, and maybe you can speak with this, is that while climate change or increasing heat and air pollution sort of work together, as you guys explained, they also share a similar source. Isn't that true? And maybe you can talk about why that's important.
So you raised also, you said, where you are matters for air pollution, and I haven't addressed that yet. So we know that is also true because we know that if you're close to a major roadway, like an interstate highway, and you're within 1,000 feet or a few hundred meters, that you on average will have slightly higher exposures to the fine particles that we know can get deep into the airways. Those are coming from tailpipes. They're coming from combustion and emissions related to fossil fuels. We also know that in our region, air pollution is related to our power plants and to our heavy industries. And so there are some feedbacks as well. The warmer temperatures and the higher number of extreme heat days, that those increase the chemical reactions that form some of the air pollutants that impact human health. So there's a feedback there where more warming is leading to sort of worse air pollution. It's also driving more energy consumption because people have to use air conditioning to cool themselves. There's more energy utilization, which means more emissions related to generating power, at our legacy fossil generating sources. And so we need to address those on a societal basis, even while individuals need that cooling in order to stay safe. So where you live is very much related to the exposures that you have, both for temperature and air pollution, and that those two factors, temperature and air pollution, are also related to each other.
Dr. Sheffield, did you want to add to that? About the way air pollution and heat sort of work together to actually make each other worse, and what that might mean for kids outside, or it's something that you can't really see most times.
Right. Yeah. And heat is definitely underappreciated as a health risk factor. I agree with what Allan said, and I'm excited to see initiatives like the electric vehicle initiatives that are not just about that are now extending to full sectors of society, like the government fleets of vehicles and buses. We know that communities that rely disproportionately on public transportation spend more time outside. And if they're spending time outside, they're getting exposed to those outdoor exposures, whether or not it's air pollution and or heat. And it's all the more important to have things like electric buses doing those runs. Things like electric buses in the bus depots that have been disproportionately built in neighborhoods where people already experiencing a higher burden of environmental exposures live and work. And so all of those things are interrelated, and ultimately we think of this as a multi-pronged approach where we are working at a societal level to transition to cleaner fuels, whether or not that's in what we call point source, so what we're burning in buildings, or in mobile source, what we're burning in vehicles that travel around, while we're also figuring out on an individual level what we can do to reduce those exposures.
Given that we just went through both air pollution and mold, we have a question from the audience. Is there a role for indoor air purification? Is there a clear benefit to that?
Yes, I think there's good evidence that filtering the air, not ozone generating, not ionizing, but doing things that are actually taking particularly particulate matter out of the air can improve indoor air quality in meaningful ways that have health benefits. So that coupled with good air exchange when possible, especially if the outdoor air is cleaner or as we get it cleaner, and reducing sources of indoor pollution. And there's a lot of sources that people don't necessarily think of as pollutants, but whether or not that's fragrances in personal care products or cleaning agents or things that people use for their creature comforts, like burning of incense or things like that. So there's a lot of things that people can do to reduce the sources too, and coupling that sometimes with air purifiers.
Here's a question, interesting. Has the wearing of masks during the pandemic had some health benefit by reducing our exposure to some of the environmental health impacts that we're talking about today? Might be a tough question to answer. Certainly something worth investigating if we don't know the answer right now. Thoughts?
So I think that wearing masks and sort of increasing awareness of, for example, hand hygiene certainly has some knock-on benefits for decreasing other infectious diseases and the flu and things like that, which is very important to public health. I think for exposure to air pollutants, we're talking about very, very small particles that are, much finer than the width of a human hair. And so you'd need to filter those out, you need really close fitting masks like the N95 that are used by clinicians. And so some of the cloth-based masks they're important contributors to public health, but I think we would need to do more work to get into people's hands the kind of masks that would really reduce a lot of the fine particulate matter.
Understood. That sounds right to me. Okay, quick question. The final question. What is the highest impact thing that you would recommend to our audience today? If you could recommend one or two things that you think people who joined us today who clearly have a sense of concern about climate change, is there any bit of advice that you could give them in terms of a high impact action they could take? And you've got 10 seconds, Perry. You got 10 seconds, Allan, because I do need to get to the closing here.
I can't be limited to one. I think one, I've already heard that people have been inspired by past lectures that ventilation matters in the spaces where we live, but then coupling that to climate change action about ultimately trying to reduce catastrophic climate change takes working together. And so I mentioned that social networks are a key health determinant. They're also a key determinant in how effective we are in advocating for change in our society.
And my take home, in addition to Perry's point, is to continue to look for those collateral benefits where we can make changes to our homes and in our communities that benefit our whole society, that are supportive of health and climate change. And improving the insulation in a building or talking to a building manager about how it's heated and cooled can have benefits for human health and for the climate. I think really looking for opportunities, designing healthier parks for children. These are ways that we can, as a society, support a transition to a more just and a healthier future.
Thank you both. This was a lot of great information. Thank you again. Again, a couple things. There is a survey, if we can bring up the slide. You will be receiving an email with resources discussed today, as well as a survey. I believe we should have a slide. You can also scan this QR code, so you can just complete the survey that way. It's really important that we get your feedback. It has a big impact on what we do. If there are any questions we didn't get to today, we will include all of those in the email as a follow-up, so watch out for that. Thank you for coming. Join us next time for Dr. Aurora. And again, complete the survey. We need the info. Thanks again. Enjoy the rest of your day.